Left ventricular dysfunction with subsequent heart failure is the final common pathway for several cardiovascular diseases. In this Med Mastery lesson, we will review the clinical applications of strain imaging in detecting cardiac disorders, primarily focusing on indications and pathologies that you should be aware of when performing strain imaging. Let's begin with how strain imaging can be used to detect myocardial infarction. In a normally functioning heart, the strain graph that represents all of the wall segments should be in sync with and slope down at the time of aortic valve closure, or AVC. On the bullseye plot, the strain segments should be all red, indicating that the myocardium is contracting normally. And the GLS value will be less than or equal to minus 18%, which represents normal overall left ventricle function. In the case of myocardial infarction or left ventricle dysfunction, the strain graphs are not in sync with or slope downward together with the AVC. And the wall segments don't move in the same way indicated by the disorganized lines. On the bullseye plot, any akinetic or aneurysmal basal walls, indicated by blue, suggest myocardial dysfunction and regional specific patterns of ischemia or infarction. This can be determined by looking at the GLS value, which will be less negative. In addition, strain imaging can detect a mild reduction in systolic shortening in the absence of regional wall motion abnormalities or left ventricular ejection fraction reduction, indicated by the pink areas on the bullseye map. So, in left ventricle dysfunction cases, strain imaging can produce different qualitative and quantitative data for you to analyze and confirm any abnormalities. Moving on to heart valve disease. Heart valve disease, such as valvular stenosis, occurs when the heart valve does not open or close properly. Research has shown that strain imaging can detect myocardial damage earlier in patients with an asymptomatic aortic stenosis and a normal left ventricle ejection fraction. The GLS values were found to be greater than minus 18%, for example, minus 17 or minus 16, in comparison to those from a normal healthy heart with GLS value less than minus 18%. For example, minus 19 or even minus 20%. The strain graph and GLS values will look very similar to the ones we described for myocardial infarction. So even though the left ventricle contraction looks normal, strain imaging can detect myocardial damage earlier. Lastly, strain imaging can be used to assess hypertrophy. In the case of increased wall thickness and the left ventricle mass, GLS analysis can detect subtle changes in the myocardium and monitor the progression of these changes in the presence of a normal left ventricular ejection fraction. For example, this patient has a basal septal bulge due to hypertrophy, which indicates early signs of ventricular remodeling and will affect the strain imaging data. Specifically, it can reduce strain near the basal and mid-left ventricle wall segments. The values will be less negative and closer to zero, which will also decrease the average GLS value. In the case of increased left ventricle wall thickness and/or mass from hypertrophy or cardiomyopathy, systolic function is usually normal because the left ventricle cavity volumes are reduced. But analyzing the pattern of strain can help identify regional segments that may be reduced due to hypertrophy. Hypertrophied regions have reduced myocardial deformation and therefore produce strain values closer to zero. So the bullseye plot will display shades of pale pink, suggesting a reduction in deformation, and the overall average GLS will be reduced. If performed correctly, strain imaging can help you detect early changes in the left ventricle. And diagnosing cardiac pathologies accurately helps cardiologists make better clinical decisions for optimal patient care.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.